Okay guys, let's talk about myocardial infarction, aka a heart attack. So what happens in a heart attack? So the coronary arteries become narrow due to a plaque buildup, and this decreases the amount of blood flow and therefore oxygen. Due to this, angina occurs and can cause some ischemia, known as cell death. Eventually, the plaque ruptures, causing a blocked artery, which is where the myocardial infarction happens. So what are the signs and symptoms? So we'll have sudden, crushing, radiating pain. Some patients describe it as an elephant sat on their chest or like a tight belt. Shortness of breath. They can have nausea and vomiting, sweating, and they can be pale. Now in women, they present differently. So they can have shortness of breath, abdominal pain, and also shoulder blade pain. So how are we going to diagnose a myocardial infarction? So first off, we'll be doing an ECG, and we may see ST elevation. And if this is the case, most patients go to the cath lab for intervention. We may also see ST depression or T-wave inversion, and we'll also do some bloods, and we normally have a troponin elevated. So memory trick coming up. So we treat a myocardial infarction with the mnemonic MONA, but we give it as NOMA. So we give nitroglycerin, which opens up the vessels. Then we give oxygen to decrease the amount of oxygen going around the body, morphine to decrease the pain, and aspirin to prevent platelets sticking together. Patients may or may not go to the cath lab, and they may or may not have thrombolytics. So following the myocardial infarction, all patients are started on prevention methods, which rest the heart. So we have nitroglycerin, which relaxes the vascular smooth muscle, and this is used as a just in case, and patients should carry this with them. They're also started on beta blockers, which lowers the heart rate and the blood pressure. And finally, they're also given calcium channel blockers, which lowers the blood pressure. Hope that helped.